Hello, this video introduces the African swine fever total diagnostic system. African swine fever is a highly contagious viral disease that causes sudden death and high fever in domestic and wild pigs. When a pig showing suspected symptoms is found on a farm, the farmer must immediately report it to the quarantine agency. Upon receiving the report, a quarantined veterinarian visits the farm and collects samples, such as blood from the suspected animals. At the farm, the veterinarian performs a point-of-care test using the African swine fever virus antigen rapid kit with a blood sample. Regardless of the test result, all collected samples are securely packaged and sent to an authorized diagnostic laboratory. In the laboratory, real-time PCR is performed on blood and related samples, while ELISA is performed on serum samples. First, we introduce the genetic test kit. If the genetic test shows a positive or suspected result, the sample is retested for confirmation. Samples confirmed positive by the ASFV qPCR version 2.1 are further analyzed using the ASFV 3-diff qPCR to differentiate between genotype 1, genotype 2, and recombinant strains of the ASFV. Next, antibody testing is performed. If the antibody test result is positive or suspected, a confirmatory test using the indirect immunoperoxidase method, or IPT, is conducted. Median Diagnostics is setting the standard for African swine fever diagnosis. Thank you for watching.